I recently spent a week in hospital, which included admission through A&E and a significant amount of time spent on a public corridor on a trolley bed, being quite severely unwell. And I want to talk about how that feels, because when we talk about the NHS waiting times, when we talk about overcrowded corridors, when we talk about funding the NHS, privatising the NHS, very few of us have actually had that level of experience. And apparently I want what I go through to be what you go through. So we're going to talk about it. First thing I didn't know is that the hospital corridor, the public corridor on which there were dozens and dozens of beds lined single file against the corridor wall, are semi-permanent sort of fixtures. There are hospital corridor bed spaces. So you have a sign on the wall that says you are in corridor space 18 or whatever it is. I saw them go as high as like 30 something. This is not an emergency situation. This is something that has been normalised. Second thing I didn't know was that the hospital corridor is not the first rung of the ladder. That's not the lowest of the low. You've first got to go through, unless you're brought in by an ambulance, you go through a walk-in A&E and you're in a seated waiting area. Now, I was desperately unwell in an overcrowded, standing room only, seated A&E area where I was, on the verge of passing out, and was still not able to get a bed because a space on the corridor had not yet become available. I repeat, a space on the corridor. The corridor was full and I had to qualify for a bed on the corridor. Spent about 24 hours on the corridor in one of the brightest, loudest, most public, most undignified environments I can describe to you. During the day, people visiting, inpatients, outpatients, staff. There was a constant stream of people walking through a main public corridor where dozens of really quite unwell people were trying to rest. Blood tests are done on corridors, examinations are done on corridors, the conversations with doctors, if you're lucky enough to see one, is done on the corridor. They are noisy, overstimulating environments full of people who are not just physically unwell, but mentally unwell as well. I heard people groaning and moaning and desperately asking nurses for help. I've seen ladies in their 90s wearing almost nothing because their dementia has meant that they're walking around half naked, not able to look after themselves in any way, and they've just been dumped by a care home into A&E through an ambulance. Nobody was with them. I heard several people asking to die. After that stint in A&E and on a corridor, I was transferred to something called an acute medical unit. Now, this is a bit like a ward where they decide which ward you're going to go to if you're staying. So you are kind of on a ward, but it's a very fast-paced temporary ward where people come and go at all hours of the day. I was there for 4 days. And this is, again, one of the brightest, loudest, most overstimulating environments I've ever experienced. The fact that people there are really unwell, need to rest, need to convalesce. There are discordant beeps, noises, multiple conversations. And despite only four patients being in the room at the time, there is constant flow of people. There's visitors, multiple, but at one point there must have been 20 people in that room, all talking at the same time, whilst the people around them are really quite unwell. There is no privacy. Yes, you can draw a curtain, and hilariously, a doctor will come round, draw a curtain, and then have a full volume conversation with their patient. There is no privacy. Sleep is disrupted not only by observations that nurses need to take, but by constant beeping, constant noise. The hospital is a very 24-hour type of environment. And what little sleep I did get, I had nightmares about being on display at a museum, about what felt like a massively undignified, humiliating experience where I'd lost bodily autonomy, I'd lost any kind of control over my situation. And if you follow me along on here, I'm sure you can appreciate I'm someone that can advocate for themselves quite clearly, but I was really unwell and I felt unable to advocate for myself. I felt unable to take in information that was all given verbally. All doctors and nurses give you verbal information. Now, I don't process verbal information at the best of times, but when, crashing out on a hospital bed in a massively overstimulated environment with extreme sleep deprivation, I was not able to take that in. After those few days, I was moved to a gastrointestinal ward where I was treated by specialist doctors and nurses, a much calmer place. But it was 4 or 5 days before I got there. Now, in all that time, I met people and I recorded that I was cared for, and I do mean cared for, by people from 14 different countries. I met one nurse who was in Sri Lanka when the Boxing Day tsunami hit and was inspired to go into nursing because of the recovery workers that they saw. I met a nurse from India who told me about how global warming is making snakes breed more in India and they're attacking children. And she was inspired to go into nursing because she wanted to help those children. She came here to train. I met nurses from Nigeria. One in particular was unable to save a very close family member and was inspired to go into healthcare as a result. Every single person, from whether it was local or international, all of the nursing staff gave me ultimate care. When I witnessed them caring for other patients, the level of detail, the emotional labour that those nurses go through in order to turn an old lady who can't move for herself. There's lots of, right, love, darling, sweetheart. I mean, like, some people might find that inappropriate. I found it ultimately comforting. They never stop. They never, ever stop. And everything is kind of really important and critical. So I was chatting to a couple of nurses who told me that on one of the exams, you have to get 100% in maths, because if your maths fails in an environment like that, somebody could die. So I witnessed a constant amount of checking, calculating, working things out, accuracy and attention to detail. Every day, every shift change, my nurse came up to introduce themselves. They told me their name. They told me they would be caring for me that day. They were available if I needed anything. Despite being the busiest, most overrun people I have ever witnessed in a work environment. Whilst doctors oversaw my care, it was the nursing staff, it was the domestic staff, it was the staff who bring food and take orders, it was the healthcare assistants that ensure that people are clean, fed, happy and comfortable. They are the ones that are running the NHS, and it is a multinational health service. I've made some other videos on why the health service is overcrowded, and it's through the social determinants of health. The demise of the NHS and the degradation of the services that we receive, the chaos, the volume, the emotional distress, the physiological, psychological, all of that distress that we experience as patients in the NHS is a result of political and economic choices. Whilst I was in hospital, The Guardian put out an article to say that racial abuse for NHS staff and nursing staff in particular is up 86%. And I saw it. But all of this is a choice. This is a political choice. It's a choice to underfund and run the NHS into the ground, and so that privatisation is the only sensible option. It's not. We've underfunded our local government services, our preventative health services, our social care services, and that is a direct pipeline into pressure on the NHS services. Again, political, economic choices have been made through austerity to decimate these services, and the impact is now where people are lying on corridors for days, being critically unwell, in a complete loss of autonomy. I cannot describe enough how degrading and fucking emotional that place is. I was in a hospital in East Lancashire, which it serves a deprived population, and I'm pretty confident that in areas with more prosperous populations, they have better services. I hope they do, because for everybody to be receiving this level of service, I don't know how we're functioning. Having said all that, this is not a complaint about the care that I received. It's not a complaint about the hospital I was in. I can see very clearly the structural, political and economic impacts of the decisions that have been made way outside of the healthcare system over the last 15 to 20 years. This is the result. There is a lag. When we cut services in one area, when we go upstream and we decide to really reduce the welfare state, what we end up with further down the road is health problems that are, I mean, the amount of COPD. So thank you very much to the Royal Blackburn Hospital for looking after me, for the nursing staff in particular. And if you are in any way inclined to vote reform because you think our multinational health service is not something that you want and that you want to privatise any of it, then fuck you, because we need a better policy. And that is just not it.